Hi, I'm Dr. Luke Wells-Smith. I'm here with Ranvet today and I'm from Motion Equine Podiatry Consulting. Today we're going to have a little bit of a conversation about how to maintain hoof health. So you might have seen our previous videos on basically how I assess hoof health through looking at hoof growth, hoof mass and hoof structure. So now we're going to have a little bit of a conversation about how we basically maintain our hoof health in our horses. And the things that we're going to look at are the environment, a little bit about our farrier practices, and then finally a little bit about nutrition and supplementation. So one of the major components of maintaining hoof health is actually looking at your environment that the horse lives in. Obviously we can't do a lot about it. Sometimes with horses that are maintained out in the paddock, they've obviously can be quite wet throughout winter, or it can be quite dry in summer, but it's worthwhile having a look at these things to make a bit of an assessment. If we've got a horse maintained in a box long term, obviously that really dries out the hoof capsule. Similarly, if they're out in a muddy paddock, that can create a sort of overhydrated status as well. So looking at the environment that the horse lives in is a really important consideration when we're talking about hoof health. So the second part of maintaining hoof health is to understand our farrier practices. When I'm thinking about what sort of things I'm going to do with a horse in terms of maintaining their hoof health, we really want a whole horse approach. There's lots of things to consider, such as the horse's discipline. Is it a dressage horse? Is it a race horse? Is it a jumper? Where is the horse in its preparation? Is it spelling? Is it pre-training? Is it in full work, ready for competition? Again, a little bit about what's the horse's environment, not also where it lives day to day, but the surface that it works on. Is there any pre-existing conformation faults or lameness? Are we looking at a horse with a mismatched foot conformation? Also talking to the owners about what their budget is and their commitment to the management of this case. Our shoeing cycle is important. It can range depending on what that horse, what we're hoping to do. It can be as short as 4 weeks, or in some cases, if we have a horse with minimal hoof mass, we might be looking at an 8-week cycle. And then also using x-rays to sort of monitor the progress of our cases. And even in some cases, even if we've got a healthy horse, just to have a look and make sure we've got a bit of a baseline. Like you can see in the images, we've got 3 totally different types of shoes. One on the left being pretty stock standard aluminium race plate, the one in the middle being a wedged heel egg bar shoe, and then the final one is a heart bar, a wedged heel heart bar that we can use on horses, particularly with laminitis or even in some cases with heel pain. And then we'll move on to nutrition, and as we discussed briefly in our talk on hoof growth, nutrition is a really important consideration. Obviously at the moment in New South Wales and Queensland that's in drought, we've obviously got horses on poor quality pasture, which could be affecting hoof growth and quality. And then we go to the other extreme of that, where we've got horses maintained on a really rich sort of spring grass that has high levels of non-structural carbohydrates, which can predispose our horses to equine metabolic syndrome, which leads to laminitis. That obviously affects hoof health and not great for maintenance. But then the final thing to think about when we talk about nutrition is hoof supplements and supplementation. Ranvet has a product called Hoof Food, which contains a high level of biotin and 6 key ingredients for hoof growth, which can really help you maintain your horse's hoof health. And that's brought us to the conclusion on maintaining hoof health in your horse, looking at, once again, the environment, our farrier practices, and nutrition and supplementation. Once again, thanks to Eve for standing still and being a great patient today. Thank you.